governor very accurately said, these programs were jointly put in place with interest groups, EPA, DEQ, Dr. Edwards, water quality experts. So it really is a number of programs that were put in place to have a comprehensive review. So as many of you know, we started out with the Sentinel testing program. We actually had a number of locations across the city where we overlaid a number of factors, age of water, condition of distribution systems, environmental justice, elevated blood lead levels. And so we put together a Sentinel program. We had 5 rounds of those Sentinel programs. We had over 600 people that actually participated in that. And to those individuals, I say thank you very much. Then we went into an extended Sentinel program. And those really were Tier 1 sites, those with lead service lines, those that we had high lead levels, kind of the worst first type scenario. And we just reported out our latest Tier 1 sites. Out of 85 Tier 1 sites, only 4 exceeded the action level of 15 parts per billion. The 90th percentile of the latest round is 10 parts per billion. If you looked at all the individuals who participated in it, and this is about 160 individuals, the 90th percentile was really 9 points per billion. So 100% of the Tier 1 samples were below the copper action level of 1,300 parts per billion. So there was a handout that's on the back table that really shows lead levels in Tier 1 sites. Those are only Tier 1 sites, not all the sites. And those are the ones that are of regulatory significance. Of course, those are the ones under the lead and copper rule. But you can see that there is a trend line there where 95.3% are at or below 15 parts per billion. The other thing to recognize is that we only had one sample that exceeded 100 parts per billion. And that sample came in at 158 parts per billion. So that says that data chatter, which I'll call it, is normalizing. So our data continues to get tighter, and we continue to have more confidence in the system. We also have done extensive residential testing across the city of Flint. So as of the 21st of September, we had nearly 25,000 samples that we've tested across the city of Flint, and 92% of those samples were at or below 15 parts per billion. We now have high lead level and copper level response teams that go throughout the city. If you have high lead levels in any of your samples, we respond if it's above 150 parts per billion within 2 days. And if it's above 100 parts per billion, we respond within 7 days. We also, as the governor has said, we've taken over 7,500 samples in schools. And so Freeman Elementary School, if you will, which was kind of ground zero, in June, 194 of 194 samples came back as non-detect for lead. And so we've replaced fixtures with our friends at licensing regulations and with the plumbers. And we've put best practices in schools so that after vacations and as there's quiet times in schools, that there's flushing practices and protocols. We've taken over 1,400 samples where there's been elevated blood lead levels relative to water. And then our friends at the Michigan Department of Ag and Rural Development, they've actually visited all 381 food establishments. They've taken over 476 samples. They have best practices in place to assure that those that are delivering food, ice, water, and Flint meet standards. So, Governor, that's the update. Thank you.
Captain. Thank you, Governor, and thanks everybody for the opportunity to speak today. Our team's mission has been to ensure everyone affected by this emergency has access to safe, clean drinking water. We're committed to everyone affected by this crisis working to regain the trust and the faith of the residents and their families who we deeply care about. We have a robust operation in place still today, and this includes a warehouse and logistics system to ensure all residents have access to those supplies. This services the 9 community water resource sites, more than 30 faith and community-based partners, which is through the Food Bank of Eastern Michigan, and all of the schools that are affected by this crisis through other partnerships. Not to mention an access and functional needs system to ensure Flint's most vulnerable residents are served water supplies through a door-to-door delivery service. Today, as I mentioned, there's 9 community water resource sites open, one in serving each of the city's wards, and their job is to distribute water supplies throughout Flint and these community partners have graciously allowed us to use the property that they have to help the city and the residents. Overall, since January 9th, through both water response teams and the water resource sites, more than 2.9 million cases of water. And you have these numbers on that paper on the left side. More than 2.9 million cases of bottled water, more than 138,300 water filters, more than 300,900 replacement cartridges, and more than 54,700 at-home water testing kits have been distributed to Flint water system customers. Although residents have a choice between bottled water and filters, I want to stress that under a consensus of local, state, federal, and outside experts, water filters have been found to be effective in removing lead from water. We want to continue to encourage Flint water system customers to use filters more than bottled water, as has already been mentioned, because that keeps the water flowing through the pipes, which helps improve the system even more, and that will drive better water quality for everybody in Flint at a much faster rate. I do want to mention regarding access and functional needs that in partnership with United Way 211, we've been working closely to ensure Flint's most vulnerable residents receive the water supplies that they depend on every day. We receive a list 4 times a day from United Way 211, updating those lists for us. So that's a key part of our day-to-day activities. And with that, we will turn it over to Dr. Edwards.
Yeah, well, thank you, Captain. And before we ask Dr. Edwards for some comments, I just want to thank people in particular. They've been doing yeoman's work for an extended period of time. Traditionally, they're not deployed for this kind of length. But I can tell you, like clockwork, I get an email every day from the captain and his team giving us an update on activities in Flint in terms of tracking information, and we're continuing that effort. So they've gone above and beyond. With that, Professor Edwards, it'd be great if you could share some of your thoughts on where we were and where we are today.
I'd like to start by just reinforcing the amazing work that has been done by all the volunteers, the relief agencies, the state of Michigan, city of Flint, and the EPA on the Flint disaster recovery. You know, when we started down this path, because there was really no precedent, but I and everyone else have witnessed that everyone's really been doing their best, and even with the benefits of hindsight, I don't think there's anything to fault with the response since late 2015 or early 2016, all things considered. In terms of the response, there's really kind of 3 phases to it. The first of which I will term the public health response, where we're dealing with the issue of the lead in the water, the Legionnaire's disease, and the concerns about bathing and showering. One of the first things that was done besides switching back to Detroit water was some of the best corrosion control as recommended by EPA in the world. And while this is a Band-Aid, and we now know that no matter how good corrosion control is, we can probably never keep lead out of the water to the extent we'd like to, given what we now know about the harmful effects of lead in drinking water. This Band-Aid is nonetheless important, and it is working. One of the national lessons that we've learned in Flint is that in all likelihood, as long as those lead pipes are in the ground, water from that pipe cannot be guaranteed to be safe without some sort of filter. This was discussed at the data summit a few weeks back, and this is a national lesson that we're learning and we have to think about as we come up with new laws regarding lead in drinking water and the revision that the EPA is currently considering, as well as the state version of that law. The second thing we've learned is that these filters do work, and they work at all levels of lead in the water that we've encountered in Flint. What you're really trying to do is prevent of lead rust from falling off falling off the pipe and getting into your drinking water on a sporadic or semi-random basis. And these filters do a tremendous job of that. And the EPA field work done on this is really unprecedented. They have hundreds of samples looking at some of the worst case homes, and in every single case, the filters were working very, very effectively, far beyond the manufacturer's guaranteed performance range of 150 parts per billion. So given all of that work and supplemented by other work in our laboratory, there's just no doubt that the lead filters work to completely eliminate concerns about high lead in drinking water or water used for cooking. And furthermore, I think Michigan is well on its way to becoming the best example for lead and water control in the world. This law that's being proposed in the state of Michigan is going to be the world's toughest. It will serve as a national model. And frankly, what Michigan has done with lead in schools over the last year is really unprecedented. And if you've been following this story nationally, not only have we found lead and water problems in many, many other U.S. cities at a level that's in the range of what we found in Flint, but lead in schools all around the country, whether it's Portland or California or New Jersey, these problems have been found, and folks have been kind of implementing the Michigan model to deal with those issues. In terms of the Legionella issue, I think most people are aware that this is an emerging problem that we've only realized in the last 10 years, the health risks posed to consumers by exposure to waters that have too much Legionella in them in their showers. And you do not get exposed by drinking the water in general, but again, it's small droplets of water can get in the air. And if there's high Legionella in the water, it can cause disease and deaths. And Flint had one of the worst Legionella outbreaks in U.S. history during this time period on the Flint River. And with the improved operation of the distribution system, the switch to Detroit Water, and maintaining good chlorine residuals throughout the system, we have confirmed that there are very, very low levels in Flint homes in sampling that was done this summer. And in fact, this is translated to some of the lowest incidence of Legionnaire's disease in Flint ever. And so I think everyone is looking at what happened in Flint here and evaluating the data, because this is a very new problem and unlike lead, and we're learning more every day. But what we can say very clearly is that the water distribution system is being operated in a manner now that minimizes the likelihood of bad bacteria growing. We continue to monitor the problem with rashes, but as observed by the CDC study, it doesn't look like Flint has higher incidence of rashes compared to other water systems in the United States. We know that people do get rashes from exposure to water. Unfortunately, this is very well, but we're continuing to monitor this situation carefully, because for those who are afflicted by this problem, not only in Flint and all around the U.S., it can be very problematic. On the infrastructure front, I think that battle is really just swing into gear, and part of it is limited by, I think, federal funding, which I really feel that we have to look more seriously at the federal government's role and what happened in Flint, Michigan, and that there's a moral case that needs to be made that the federal government should share some of the fiscal responsibility for the recovery. But replacing these lead pipes is going to be expensive, as is upgrading the water mains, and both of these things have to be done. I don't think that Flint residents can afford to upgrade this infrastructure on their own. And of course, eventually we're going to have to consider the loss of trust that resulted, and some people in Flint have seen the response once again trusting city, state, and federal employees, but others, I think that trust is going to have to be earned back slowly, and for still other residents, they will never again trust the quality of the water that comes out of their tap, whether they continue to live in Flint or move elsewhere in the country. So I think the only thing we can do going forward is to be trustworthy and be honest, and I think it is doing that at present. Thank you.
Well, thank you, Professor. I appreciate your comments. And now let's open it up for questions.
Stick on top of the question, please.
Okay, so I just kind of wanted to ask about we're talking about a KWA pipeline happening in Flint, and even if that water is distributed and goes to the people, I don't know if the question's for Dr. Edwards or who, but will it make a difference if we haven't finished replacing all the?
Yeah. Well, one of the things is the city made a decision to move forward with KWA. But to go to your point, I appreciate Professor Edwards' comment. Is we proposed legislation that would essentially make sure we're on a path to remove lead service lines. And that's an answer not just for Flint, but that would be a good answer for across our state. And that's something we would continue to encourage the EPA and the federal government to look at better, to do that across the country. One of the roles that is being addressed by the Infrastructure Commission that I created is to look at it in the statewide context of not only what needs to be done, but what are the cost considerations of that and what's an appropriate time frame. It's good. I do want to recognize the city's doing a better job in going faster now with respect to lead service lines, and we're encouraging them to continue to pick up the pace on that, but we are seeing progress now.
I'm sorry, I have one more question. This is about the integrity monitor. Can you tell that to someone who's going to oversee Flint aid?
Sure. I view that as simply a good kind of audit, check and balance on the system. That was something that was added by the legislature, I think appropriately so, given that we're talking in the state case about $234 million of state assistance. And given that amount of money, to say that there's someone helping for that in terms of looking at audit trails, compliance is a very appropriate thing. So we just put that out so it would be there in place for the next fiscal year, for our next budget year.
So on the recommendations from the task force on the emergency manager law, why are you waiting on the legislature's report? I mean, you've seen clearly what their recommendations are. You've had many, many months to decide whether you think that's a good policy idea or not.
Yeah, I just want to make sure we can do it as close alignment, because again, many of these things could be legislative things that we'll want to take action on, and I just didn't do it with my partners.
And have you reached a personal conclusion on these proposals? Things like
well, what I would say is
I
I basically concur with what they said, that there are improvements possible in terms of looking at better consultations and such. But the specifics, I'm really waiting to do it with my legislative partners. And I expect that to happen before the end of the year.
Governor, while you've been aware of the problem for a year now and the state has been working to address it, the reality is that it's been going on for a few years. Are you, I know you've been hesitant to do this, are you able to give us any sort of timeline on when the water will be safe without a filter?
Speculate on that. I think you're seeing increasing confidence grow as the water test results are going on. In fact, we have another sample we're waiting to get the data back on as we speak. So we've been doing this in an ongoing fashion and continuing to watch that.
But so do we think 6 months? Do we think 5 years? I mean, do we have any sort of idea?
Well, again, I don't want to create speculation. What I would say is as a practical matter, the water's safe to use with a filter today. That's been made extremely clear, and I think all the experts agree on that in terms of the filters are working. And we encourage people to use the water. As we continue on this path, again, as we go through this process, hopefully we can continue to say there should be some point where you don't need a filter. But again, people may always want to exercise some caution because, as Dr. Edwards said, you can run into this particulate problem potentially until you've got your lead service line in place.
So Dr. Edwards, do you believe, if I may ask Dr. Edwards, do you have a timeline in mind or an idea of when the water will be okay to drink without a filter?
So just to give you some emerging consensus on this, at least from the perspective of myself, an EPA scientist, based on the very intense that we have been doing in the Flint system, in the Chicago system, and in looking at data from other cities around the country, and New Orleans, there is a strong belief developing that no matter how good corrosion control is, we will never again be able to say that water from a lead pipe is safe. Corrosion control is a band-aid, and in retrospect, we were a little bit naive to think that we could keep the lead on the pipe and out of the water to the extent that is necessary, given what we now know about lead's harmful effects. And so, reviewing this data, most of the scientists, again, who look at this, feel that lead pipes are there. And filters are not in place. We will never again be able to say that water coming through a lead pipe, regardless of how good the corrosion control is safe by modern standards, not only in Flint, but all around the United States. And so what we're looking at is obviously the only way to be sure the water is safe is to get rid of all the lead plumbing or use a lead filter. So I think this is some of the silver lining that's happened in Flint, the intensive monitoring that we've started to have this emerging consensus. I think it's likely that at present Flint is meeting the federal corrosion control law, but as you know, there is a consensus that 25-year-old law is not sufficiently protective in Flint in the United States. But frankly, without filters, I don't think anyone in the U.S. should trust water from a lead pipe.
So for my clarity then, and I apologize for taking a little bit of time, right now roughly 115 pipes have been replaced in Flint. And if I'm understanding Dr. Edwards correctly, he's saying he does not believe that it would be safe to drink the water in Flint without the use of a filter until all the pipes are replaced. So looking at that timeline, that seems like it would be several years down the road.
Yeah, well, first of all, not all the pipes are lead. So this is part of that analysis of going through that process. So again, this is where you get the of knowing what is and isn't, and that's still a challenge because of the time frame and the lack of information. But the majority of pipes, according to the data that we have, show they're not lead. And so that's where the focus is on. I think the number was roughly 4,000 to 5,000 lead service lines. There's an issue with galvanized iron potentially if it was integrated with a lead service line in some time frame. So this is where we're still doing that ongoing work.
Governor, other people have lead pipes around the state of Michigan. Is the state prepared to say today that if you have lead pipes, you should have filters, and if you make that statement, should the state pay for them?
What I would say is that's not the current standard in our country. I mean, it's been very clear that people are to be made aware of the issues. There's information requirements. This is one of the challenges we want to and we want to have a stronger law in Michigan than the rest of the country. But under current federal law, that's not part of the process at all. Again, I think what Professor Edwards was indicating is if you have a lead service, seriously look at the issue of potentially having a filter if you want complete confidence.
Well, shouldn't the state mandate that to protect the public?
Again, I'm not going to proclaim that. I think that's something that we can always discuss as part of the legislative process.
You're concerned about the cost if you do proclaim it.
Well, again, you have to look at the whole consideration, and that's part of looking at all our infrastructure over the long term in this country.
Governor, you proposed
I just wanted to ask you about it. Where are we at in terms of reaching a conclusion about the role Flint's water played in the Legionnaires' outbreak?
Actually, I think that's part of an ongoing study that we have going. Wayne State is actually doing a lot of work for us in terms of we commissioned them to do a study, and I'm not sure it's looking back as a question of Legionella in terms of the water system, and that's an ongoing study.
Has there been any conclusion reached yet?
I don't believe so, and I'm not sure what the timeline for their report to come out. Do you know?
probably within the next year.
Governor, does your administration have a firm count on how many lead pipes there are in the state right now?
In the state, no. Again, that would be part of a broader study to look at infrastructure across the state, because it varies by community dramatically, just as it did in Flint.
In terms of how they keep the records?
Yes. Some communities have been fairly proactive. Again, Lansing was a case that we know. They actually systematically looked at this issue, and I think it was over a 7-year time frame. They believe, I think they've replaced most or all of those. So there's a good role model of a community that was proactive on this, going back several years.
FWIC proposed, and you agreed with, a lead and copper rule for Michigan many months ago. Why has nothing happened on that front legislatively to try to get this moving?
Yeah, I think that's something that we continue to talk to legislators. We've had a lot of groups be the legislation from our side, and I hope to move forward. Again, we're in an election year, so in terms of legislative days, it's fairly challenging given all the activities they had prior to us bringing this up as a topic to get in the queue. So hopefully we may have an opportunity this year still. If not, it'll be something I'll be making an emphasis of at the beginning of next year.
Do you worry at all about educating legislators, new couple of lawmakers, on all the background of this issue and policy recommendations pushed through down to you?
You have that in any case. I mean, this is a difficult and complex subject, but that's where I do appreciate the fact we have good outside experts like Professor Edwards has been a big help. Again, we're trying to make sure we're in alignment with the EPA and the DEQ in terms of what we're saying to make it more straightforward. But this has been a challenging point for our entire country.
Governor, are you happy with the compromise apparently reached this morning in Congress regarding putting FLIP funding into the Water Resource Act as opposed to the...
Well, I think it's progress to see it moving forward. But again, this is where the sooner we can get this done, the better in my view. So I just encourage Congress, both the House and the Senate, to move forward and get this for Flint because it's resources we can really use. Resource in terms of having an ability to do better with the water infrastructure of the city.
Okay. Sources on the Attorney General's team doing the criminal investigation say they are still not getting documents they want from your office, that your two law firms being paid $3.4 million money are not providing the documents. They may have to go to a judge to get that evidence, a judge to compel that evidence. What's your reaction to that?
We believe we're cooperating, and we're going to continue on that path to try to work collaboratively and cooperate with the investigation.
You're giving them everything they asked for?
We're trying to cooperate in an effective fashion.
And of the 13 deaths that have occurred with Legionnaires, have you visited any of those families? Have you reached out to them to give them condolences? It's my understanding one of those deaths might have been a first responder, a police officer, or a firefighter
who contracted Legionnaire's disease and died. Have you reached out to those families? And if not, why not?
No, in fact, I'm not familiar with the particular names of the families.
And
Again,
you've
we
not
know
reached
the
out to
number
any
of
of them?
deaths, but that's part of all the investigations ongoing.
You've not reached out to any of them?
That's correct.
Why not?
Again, I'm going to say that's not correct in terms of I have not reached out to them.
Question over here.
Governor, what can be done about spending more of the money that's been appropriated? I know this has been covered before. I mean, is this an issue of the city having the money? I mean, does the state play a role in kind of helping them spend these resources and get the money out to where it's needed?
Well, again, we want to be a supportive partner to the city, so we're trying to work with the city as closely as possible to get those resources out. But it is a city responsibility, and I appreciate the fact they seem to be faster in terms of they've got a learning curve and they're getting up that learning curve.
Time for one more. Zach?
Governor, you had in March, of course, opened the internal inquiry into the Department of Health and Human Services. You said you wanted answers about what had happened with Legionnaires, and of course, that had to cease because of the law enforcement request. Do you, even though the inquiry had ended, do you feel like you have those answers, and have you made all the changes in that department structurally, personnel-wise, you feel are needed, or is that still on the table for continued review?
Well, again, as you said, we had to stop some of those efforts because of the Attorney General. The other part is there's actually a protective order sort of limiting our ability to get all the information we'd want. So what I'd say is I couldn't tell you that it's all those issues. What I would say is we're working very hard to improve communications. We've taken a lot of steps in the process. There's been agreements between DEQ and DHHS, for example, on sharing information much better and faster and making sure that information comes to me. As I mentioned, the emergency management people are, as they get information, passing that up on a daily basis. So there's been a lot of improvements.
Do you think Nick Lyon did anything illegal in his behavior on this issue, sir?
Well, again, I put Nick Lyon in that position to begin with. I support him as director of the department.
You think he should be charged? You think he should be charged with anything?
Again, I'm not going to speculate on that. That's a role for the Attorney General.
Governor, there are those who say, though, if you ask Dan Wyant to resign, you're confident in continuing with Nick Lyon staying as DHHS director. Can you describe the difference in how you've handled those two situations?
Again, I'm not going to get into personnel situations. Dan Wyant resigned, and I respect Dan Wyant.
Leanne Schechter-Smith cut a plea deal years ago, and specifically in her proper named suspect number 1 and number 2, the Attorney General cut a deal with her, and she could walk away scot-free, pointing the finger at 2 people in her department. He mentioned one, Nick Lyon. There could be another one above. If they are charged, and the progress of this case, that's pretty serious. What's your reaction to that?
Well, you're speculating. Again, you said suspect 1 and 2. Again, I respect the Attorney General's investigation, and we're waiting for outcomes and results from that, and as that progresses, we'll take appropriate actions. Otherwise, I don't view it appropriate to make speculation on this. One, it's not appropriate in terms of who we are, and let's just let the investigation follow its path.
Thank you, Governor. As we wrap up, do you have any closing comments? I've had several people ask if you would give a response to the Attorney General's opinion this morning about the public schools.
Yeah, with respect to the Attorney General's opinion, again, I encourage the Speaker and Majority Leader to go ask the Attorney General to get an opinion. Given that we had advice from Detroit Public Schools on one answer, they believed it was different. So I appreciate the Attorney General coming out with an opinion, and just came out today. So we'll have to go through the review process of looking at it. And so we'll be doing that diligently.
Can you say the schools in Detroit, some of them, the low-performing ones, won't close this year?
Again, that's speculation. We have an opinion now from the Attorney General that needs to look at it in due course. What I would say with respect to the session today, hopefully you can see that there's been a lot of progress in Flint. there are still a lot of challenges, and there are things we need to work on. This is an opportunity for us to improve all of Michigan, though, in terms of better water infrastructure, understanding these issues more. I appreciate Professor Edwards' comments that, in many respects, this was a terrible tragedy. We're still working hard to overcome the obstacles faced by families in Flint, and my heart goes out to all of them and the challenges they faced, and we're working hard to address those. But let's learn from this and see how we can be stronger and better as a state. And I want to thank the professor, the doctor, all the people, all the volunteers that have been so great about helping us get through this challenging time and continue to help us. And I want to thank the team for their great efforts of all working together through these challenging issues. So thank you.
Thank you, Governor.
Thank you, Dr. Edwards.